Coming down with fever after large volume liposuction can be a concerning complication that warrants attention, prompt intervention, and of course a need to discuss it in this video that I would implore you to like, share, ask questions in the comment section, and of course subscribe. When I counsel patients preparing for liposuction about fever following liposuction surgery, I make them understand that for a few patients who would come down with it, severity may differ, as in it could be high grade or low grade fever. And if high grade, could be the worst fever they've ever experienced at that point. When a patient develops fever post-liposuction surgery, several factors could be at play. Number one, it could be an inflammatory response. Liposuction is a surgical procedure that involves trauma to the body's tissues. This trauma triggers an inflammatory response, which is a natural part of the healing process. In some cases, this inflammatory response can manifest as a fever as the body works to repair the damaged tissues. Number two, it could be a sign of infection. One of the primary concerns with any surgical procedure is the risk of an infection. Liposuction creates small incisions through which a cannula is inserted to suction out fats. These incisions can become infected, which may present with symptoms such as fever, redness, swelling, and warmth at the site of the incision. Number three is fluid imbalance. Large volume liposuction involves the removal of a significant amount of fat and fluid from the body. This can sometimes result in shift in fluid balance within the body, leading to dehydration or even electrolyte imbalances, which may contribute to the development of a fever. Number four, it could be a systemic response. In some cases, the body's systemic response to the stress of surgery, anesthesia, and fluid shifts can result in a fever. This response is often transient and resolves as the body adjusts to the changes. Adequate oral fluid intake has been shown to reduce the risk of developing a post-liposuction fever. So somewhere in this video, you would see a link to watch my video on how to optimize your water intake and stay hydrated throughout your recovery period. It is also essential to communicate any post-operative symptoms or complications, including fever, with your healthcare provider promptly. Depending on the underlying cause, treatment may include antibiotics for infection, adequate rehydration, and monitoring for any signs of other complications that may ensue.